Get a new order. Somebody like me would go to talk with her, and if she liked me better than she liked Rachel or whatever, it was a piece of cake. Those days are gone.
Because
When she and I talked at month number 27 of review this,
36 months, it would have been
not a real good business choice for me to have picked her up for only a few months. Now, I am at a disadvantage in this business in that I am a clinician clerk, a businessman. But it just doesn't make good business sense. You wouldn't do that leasing a car, I don't guess. You wouldn't do it leasing a house full of furniture or whatever. And it's not practical anymore for people to make lots and lots of changes. I've had oxygen patients, and I'm sure the others have as well, that over the course of time we've had 4 or 5 different providers, not just because they moved from Montana to Virginia or whatever. They might go to a hospital and a discharge planner in the hospital not realize that they already had oxygen. And they would hook them up with somebody else, and the first thing you know, there's 3 different companies in somebody's house. I like to think that's kind of rare anymore, but it does exist. But again, if any one thing has changed how
folks like you get equipment.
specifically oxygen equipment,
It could be said,
treatment wheelchairs and so forth as well, it's how Medicare pays for it. If anybody here today has a prescription,
because oxygen
it's a drug, it requires a prescription. If anybody has a prescription and wants to write me a check today, I'll even discount
that box a
it a
little
bit because it's not brand new.
but that's not too likely to happen.
So,
I didn't
think so. I hate that everything in healthcare is reduced to the bottom line, but it is, and if you think it is now, just wait a while. The insurance industry is
changing every day.
and it's not necessarily pretty. So,
Roger, that's just true with Medicare though, right?
yes, ma'am.
Not like if you have other health insurance.
Typically, good question. Typically, Anthem,
Blue Cross,
Aetna, Humana, the list goes on, follows Medicare.
Okay, good.
yeah.
It's kind of unusual for a lot of Anthem Blue Cross patients or TRICARE patients or Humana or others to be insured only by one insurance. Typically, and there are exceptions obviously, but most folks who use oxygen are of Medicare age and eligibility. But Blue Cross is the same way. Now, there are different Blue Cross policies. Some have different deductibles and different co-pays, especially this time of year. You're finding that out if you don't already know it because you go to the drugstore and the prescription that you paid $5 for last year is now $50. So January is a tough and interesting time as far as insurances are concerned. But to answer your question, most insurances follow Medicare's lead. Medicaid does to a point, and most of the commercial carriers do as well. Yes, ma'am. Absolutely. Absolutely. If you give me a prescription today and a check, no. I would again talk to your provider.
I'm not here to look at labels on
I'm
town.
anxious to see who's providing your oxygen.
Talk to your wife.
Let's say if we don't rent them, all home health companies rent.
Most.
We get calls all the time, especially around the holidays.
I'm sure the others do as well. People coming here from Florida for 3 days, needing oxygen.
In the back of the car or whatever.
That's one more thing. Speaking of portable oxygen concentrators, they're not all usable on aircraft. We could probably talk for a whole nother session about traveling with oxygen. That's something that may have been done before, might want to be done again because a lot has changed. That box right here is approved by the FAA for onboard use, even recharging the battery. Anybody who's thinking of traveling, who is using oxygen, needs to talk to their travel agent or the airline direct about it because it ain't easy. Yes, sir.
the battery life of that box?
4.5 hours, depending on flow rate.
Obviously, you said you can charge that on board and aircraft?
Yes, sir. If you get a seat adjacent to where one of the little pluggy things is on the floor, and they're not all that way. Again, if you're planning on traveling and you have a portable concentrator, make sure the travel agent or the airline, probably the airline directly.
Well aware of that, and I know I have to have enough battery life.
Yes, sir.
For the flight. And I have to buy batteries for that very reason.
At least you found it out before you left. Before you got the Boise, Idaho. I will also tell you, for those of you who have cylinders and tanks, if you're thinking about flying, you're in trouble, because you cannot take a tank on an aircraft. Same thing is coming true of trains, I'm told. Amtrak does not have a specific policy that I'm aware of, but selective routes make it difficult to travel with cylinder. Yes,
I
ma'am.
traveled from here to Chicago twice recently,
That's why she
24
called.
hours each time, but I enjoyed it. On the train, there were plugs in every seat.
Yeah.
Now, at the train station, Washington, Chicago, I had more trouble finding a plug than I did at the station at Washington. A policeman helped me find a plug at the station in Chicago. You pretty well, these portable tanks, you don't realize how quick 4 hours can go, especially when
Here,
you're
here.
traveling. And you have to plug in and keep those batteries charged.
And I'll tell you another problem with that is those outlets are a premium for people carrying laptops
Exactly.
and all their books and all that.
But when you have oxygen, I will honestly say only one time in 2 trips that I made in October and November, only one time did someone tell me no, they would not give me the plug.
Okay, so
One time, one young
That was
girl.
a northern
she would not.
option.
And then
That was a
this
Chippenham.
boy got up and he gave me his plug instead. And he turned out to be an EMS attendant in Atlanta, Georgia. And he got so mad at that girl. She left a book under the seat when she left, and he saw it. He didn't tell her. He said, "Good." Now, I would not have done that to her, but you know, he said that was payback for her not letting me have that plug. Laptops are a premium, you're right, but most of the time they will give them up when they see somebody with oxygen.
spill some coffee over them and they're gone.
Spill some coffee over the laptop and they're gone.
I have one more subtopic to talk about, and that is we've talked about Priestley and people in the 1700s getting us to where we are today. Let's talk for just a few minutes on how somebody who is in a hospital or a physician's office or CVS drugstore, whatever the case, goes about getting oxygen to begin with. I've told you that it is a prescription item, it requires a prescription. With the assumption that everybody in the world who needs oxygen has Medicare, which identified is not exactly true, there are a series of steps that must be completed before you can get oxygen and have it reimbursed through Medicare. Medicare requires documentation of the need. There's 2 ways to go about that. One is with what's called a blood gas analysis. Unfortunately, a lot of you all have had those done to you. It's an actual blood test, blood from an artery. The second is what's called an oximetry study. Little finger probes, if you will. Probably somebody got one of those in their pocketbook you can show if you want. But for Medicare to pay, there it is. For Medicare to pay for oxygen, one has to have an oxygen saturation of 88% or less. Now, there are exceptions, but we won't talk about exceptions. Just like I'm not going to talk today about liquid oxygen. You may have noticed I haven't brought that up. There are exceptions, but typically one has to have an oxygen saturation of 88% or less. That can be done a couple of ways. If, God forbid, somebody is here in Chippenham Hospital this afternoon, preparing to go home, this decision is made that you need oxygen, somebody is going to put that thing on your finger and check your oxygen. If it's 89, you might get it, but it's tough to get paid for at least. If it's 92, you're not going to get it because you're above the guideline. A discharge planner, social worker, nurse, whomever in the hospital, flips a switch and gets all that done through a home care provider. There's a bunch of us out there. You can either get qualified for portable oxygen, which is our topic of choice today, or just oxygen light, nocturnal oxygen, where one would use just the concentrator, no tanks, et cetera, et cetera, et cetera. And there's several ways to go about that. So if I were to run into you all in the lobby, I've been a respiratory therapist a long time. I said, gee, you look a little short of breath. I bet you could use some oxygen. I go back out with my Scion, and I come in, and I put it on, get your insurance information. It doesn't work that way. You do have to have a prescription, evaluation by physician, and you do have to meet the qualification guidelines. I don't know if this thing died or not. That's real important. And I'll also tell you, it is one of the more widely misunderstood things in acute care medicine today. I'm sure the folks in the back will tell you that they get faxes and they get phone calls every day from doctors' offices and assisted living complexes and even hospitals. They have Miss Jones in room whatever who needs oxygen. And the customer service people say, well, okay, that's great. Verify the insurance, because that's important. You don't have to pay this yourself, obviously. Have you had the oxygen level check? They say, what? Well, yeah, you have to have the documentation. Because without it, I mean, you can just give me your prescription. I'll be glad to help you, but I'm not going to be able to bill your prescription. That's why I bring that up. I hope that makes sense. I think I've got some notes here someplace, but I don't think I've missed anything I intended to say. I'm going to probably suggest we kind of go around up here and look at these machines and lift them and feel them and see what you think. But if you have any questions, I'll try to address them. Yes, ma'am.
Because I can be a big mouth because of your help to me, I know a lot about this.
I did that to
You're
myself.
calling me, you ruined yourself, I think. Seriously, I take over. Now, seriously though, you were talking about buying the machine, and Medicare would not pay for me because I've been on for too long. And I'm about into the 36 months where they quit paying. So I have to rent machines when I travel. So you didn't speak about renting, and that's what
That's true, I didn't.
Yeah. I rent.
I don't have to. You're here.
That's right, I thought you did.
Thank you for being here.
Good thing I came,
Yes,
right?
ma'am. I never did get my cake.
You were the one that taught me this, though.
And that's a real good question. You don't always get good guidance. The people in your doctor's office, unfortunately, there's no way they can keep up with all this stuff. They don't know what's covered, how much is covered, whatever. That's just the way things are. So hopefully you've got a relationship with somebody you can talk to. Back to that point, in my mind, that is the most important thing I can suggest to you as far as choosing a portable concentrator or a wheelchair or whatever. Talk to your provider. Have a relationship with them. If for whatever reason you don't have a good relationship, then there are others out there. But I don't think any of us here today would want to talk to you about switching things just because. Any other questions?
Roger, when I was on the oxygen, I traveled to Panama to fish on the Pearl Islands.
Good for you.
Now, I'm going to tell you, each leg of that airplane flight was $200 for oxygen, and I had 3 legs. That didn't count the airfare. It's just the oxygen price, and I couldn't afford it.
Now, what he's talking about is not having a portable oxygen